assistance during our webinar, please dial 1-866-229-3239 and choose option 1. Before we start, I'll go over some reminders and housekeeping items. Today's call is being recorded and will be available on our website at www.cancersupportcommunity.org/webinars within the next week. The format of today's webinar will be as follows. The panelists will begin the discussion first, and then we will open up the discussion to the audience during the question and answer session. Thank you to those who submitted questions prior to the webinar as part of the registration form. If you would like to ask additional questions, please feel free to type it into the Q&A box on the right of your screen. You may submit a question at any time during this event. This webinar is scheduled for 90 minutes. I apologize for any confusion if you thought it was a 60-minute webinar. If you need to leave before the webinar has finished, please know that we will have a recording posted within the next week at www.cancersupportcommunity.org/webinars. At the end of this webinar, you will be automatically redirected to the post-webinar survey. Please take a few minutes to complete this survey, as your input and feedback is of great value to us. I would now like to introduce the Cancer Support Community, which is the largest professionally led nonprofit network of cancer support worldwide. CSC is dedicated to ensuring that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We offer the highest quality social and emotional support through our affiliate network, as well as online or over the phone. On this screen, you'll see some of the resources we provide at the Cancer Support Community. The first one there is the Cancer Support Helpline, which is staffed by licensed professional counselors who are available to assist you Monday through Friday, 9 a.m. to 9 p.m. Eastern Time. We also have our Open to Options program, which is a research-proven program that can help you prepare a list of questions to share with your doctor. We also have our Frankly Speaking About Cancer program, which is CSC's landmark education series that provides trusted information on a variety of topics important to people affected by cancer. Information is available through print and digital publications, online, and in-person programs. I would also like to introduce our Cancer Experience Registry. This is a unique project for people affected by cancer. People who have been diagnosed with cancer and those who help care for them can join the registry. You begin by answering survey questions. Your answers and those of others describe the experience of cancer patients and caregivers. This information is used to provide education and support resources that speak to cancer patients, caregivers, and their needs. For more information or to join, visit www.cancerexperienceregistry.org. I would also like to take a moment to talk about our grassroots movement, which helps ensure that people touched by cancer have access to quality, comprehensive cancer care that includes social and emotional support. Again, if you would like to learn more about this program or to sign up, visit our main website at www.cancersupportcommunity.org. I would now like to introduce our panelists, Rosie Morrison, Kim Ziner, and Donna Piant. Rosie Morrison serves as Program Director at the Cancer Support Community of Greater Ann Arbor. An internship with Cancer Support Community inspired her to pursue a Master's of Social Work degree at University of Michigan, where she specialized in management of human services in healthcare and focused her field practice in oncology. Before joining CSC, Rosie coordinated the Guidelines Program at the American Society of Clinical Oncology, ASCO, and several health services research initiatives at the University of Michigan in hematology, oncology, and St. Joseph Mercy Cancer Center. Rosie is deeply committed to CSC's mission and has dedicated interest in health equality, evidence-based care, and patient engagement in healthcare practice. Kim Ziner is a quality of life nurse navigator and clinical nurse specialist at Franciscan St. Francis Health Center in Indianapolis. She provides support and care to cancer patients as they transition to survivorship after treatment. She is the author of numerous publications on quality of life for cancer survivors and the recipient of many professional honors and awards recognizing her contributions to oncology nursing, survivorship care, and improving quality of life for cancer patients and survivors. Donna Piant is a survivor who was diagnosed with an aggressive form of melanoma in 2011. Since her diagnosis, it has become her passion to raise melanoma awareness globally. Her advocacy efforts include sharing her story through Facebook, Fox Chase Cancer Center, involvement in patient summits and symposia, and many other volunteer activities. She created a campaign called Hand the Hoodie for children diagnosed with melanoma to raise pediatric melanoma awareness and encourage the young advocates. Although Donna will talk about her experience developing a survivorship care plan as a melanoma survivor, her experience should be similar to that of any cancer survivor who is interested in survivorship care planning. I'm now going to ask Rosie Morrison, the Program Director at the Cancer Support Community of Greater Ann Arbor, to talk to us about cancer survivorship.
All right, hi everyone. So there are millions of cancer survivors throughout the world today. In fact, the National Cancer Institute estimates that there are nearly 15.5 million cancer survivors in the United States alone, and projects that the number of cancer survivors living in the United States will increase to nearly 20 million by 2026. According to the American Cancer Society, this increase in survivorship can be attributed to a combination of factors, including early detection, better treatments, and a population that is aging on the whole. Throughout your cancer experience, you have likely heard various definitions of the word survivor or survivorship. In fact, the figures I just discussed on my last slide use a definition that is increasingly common in cancer care, in which a cancer survivor is defined as any person who has ever had cancer from the moment of diagnosis and throughout the rest of their life. However, for the purposes of this webinar tonight, which focuses on life after treatment is complete, we'll be conceptualizing survivorship as the knowledge, health, and life of a person with cancer after treatment and until the end of life. Survivorship may include physical, psychosocial, economic, and spiritual issues of cancer beyond the diagnosis and treatment phases. As you move beyond cancer, it is important to maintain a healthy lifestyle, both physically and emotionally. Here are a few suggestions to help maintain your physical health. First, don't smoke. And if you do smoke, talk to your doctor or another member of your medical team about quitting. There are plenty of smoking cessation resources available at medical centers, online, or likely in your own community if you need help, if you need support around quitting. It's also important to get proper nutrition. A healthy diet will help you keep a healthy weight and also help you replace what you use every day. If you have questions or concerns about your nutrition, talk to your healthcare team. You may be able to set up a consultation with an oncology dietitian. If not, your oncology social worker, cancer support community, or Gilda's Club affiliate can help provide resources for you on oncology-friendly nutrition, either in print or online. It can be challenging to get back into exercise after treatment or to start exercising if you didn't do so regularly before cancer. Talk to your doctor before you start a new exercise regimen after cancer. When you are ready, it's important to ease into it, take it slow, and do activities that you enjoy. Try taking a walk with a loved one, a yoga class, try swimming, biking, or gardening. Staying active will help you maintain a healthy weight and may even help prevent recurrence. If you're looking for ways to get started, there are free, professionally led exercise programs available at your local CSC or Gilda's Club affiliate. There you can sample different kinds of activities like yoga, Tai Chi, or mindfulness to see what works best for you. If you don't have a CSC or Gilded Club near you, some YMCAs offer survivorship exercise programs. Your social worker or medical team should be able to tell you what's available in your own community. Your emotional health is just as important as your physical health, and life after cancer isn't always easy. You may experience a wide range of emotions after your treatment is complete. These could include feelings of loss, anger, or sadness. You may feel like others in your life can't understand what you're going through. Many survivors also deal with fears of recurrence, or what we often call scanxiety, which means heightened feelings of anxiety or worry before a scan or checkup. Finding your new normal is an ongoing process, and it's really normal to experience some growing pains as you consider the future. You may also experience changes in body image or sexual function. All of these feelings are really normal. That doesn't mean that they're not significant, and they do deserve your attention and care. Most importantly, you don't have to face them alone. There are a lot of healthy ways to take care of yourself emotionally after cancer. You may have heard the term self-care. This can mean different things to different people, but it's important for everyone. Self-care for you might mean reading a good book, spending time with friends, exercising, getting a massage, or taking an art class. You may also consider speaking with a therapist, joining a support group, or getting involved at your local cancer support community or Gilded Club affiliate, where you can meet others like you who will understand what you're going through.
At this point, I'd like to introduce Kim Ziner, the clinical nurse specialist at Franciscan St. Francis Health in Indianapolis. She will now tell us about survivorship care planning, something she helps people with every day.
Good evening, everybody. I think, for starters, I think it's good for everyone to hear from me personally as well that I am also a cancer survivor, and my passion for survivorship care began when I learned for myself how very much we didn't know about how well to take care of people after a cancer diagnosis. So I think, along with my personal knowledge going forward, I think our focus on survivorship across the nation has managed for us all to have more attention for our cancer survivorship care. That includes groups and projects like the National Cancer Institute Office of Cancer Survivorship, the biennial Cancer Survivorship Resource Conference, which is open to patient advocates, advocacy groups, researchers, and clinicians, all meeting in a common forum. We have a Journal of Cancer Survivorship, which is phenomenal. We have Cancer Survivorship Research and Clinical Trials. So for survivors out there, check out clinical trials for what's available for you now. I know occasionally for myself I look to see what's available for people like me who were diagnosed 25 years ago or more. The American Cancer Society has a National Cancer Survivorship Resource Center. The Cancer Support Community has fabulous initiatives, and many other nonprofit organizations I think are available to us now. So, next slide, please. So survivorship care planning is starting right now since 2015 to be required of cancer centers like mine who want the Commission on Cancer accreditation. I can't say that this evening, sorry. The COC asked cancer centers to make a 5-year rollout plan for providing care plans for people with all cancers. What this 5-year rollout plan means is that although we being cancer centers are all preparing to do survivorship care planning, we have a plan for how we roll it out by either disease site or by clinical practice. So you may not all have been asked to complete a survivorship care planning visit yet, but your cancer center or oncology clinic may have someone like me whose job it is to start creating the survivorship care plans. with at least some of their patients. For now, in our cancer center, we also have accreditation for our breast center, and we're required to do 100% of our breast cancer patients in care planning. So that took the first year of our 5-year rollout plan. So what that means for those of you who don't have breast cancer and want a survivorship care plan is you can ask for an appointment for either or from a cancer survivorship specialist like myself, a survivorship clinic, or a nurse navigator who can help you either find the person in your cancer center who does the survivorship care planning or help you pull that care plan together. So next slide, please. Okay. So what is survivorship care planning? It's your roadmap for survivorship care. You have a treatment plan that's a roadmap for how you go through your treatment, what to expect during that treatment. Your survivorship care plan is really no different. It's a roadmap to guide your care once you're no longer in active treatment. And next slide. The first part of the survivorship care plan is actually what we call a treatment summary. It describes your cancer treatment you received, a list of the cancer medications you may be taking now or may be transitioning into in the future, any symptoms or side effects that you either have had starting during treatment and continuing now into survivorship. What's kind of on the right-hand side of your slide is a snapshot of the Journey Forward Survivorship Care Plan treatment summary. This is something that if you don't have a care plan already from your healthcare provider, you can find for yourself online and take a look at it. As you can see here, the treatment summary is going to include diagnosis date, type of cancer, location, pathologic stage, or TNM staging information. TNM is tumor size, N is lymph nodes involved with cancer or not, and possibility of M is signs of metastasis or actually scan-proven or biopsy-proven metastasis. So just those details that you can make note of now while you remember them, or your treatment team is making note of now while they're fresh in everyone's mind. So next slide, please. So your survivorship care plan part of the survivorship care planning, which is the second phase, often done in a survivorship visit at the same time. This piece will outline your follow-up care, what you should receive, how often, at what intervals you can expect to either have tests or follow-up care with your providers, which doctor or which healthcare provider is responsible for what in your care. For example, what's going to be responsible, what your oncologist is going to be responsible for, what your primary care doctor is going to be responsible for, what different types in your oncology team might be responsible for. Like many of us today will have a surgical oncologist, a medical oncologist, or radiation oncologist. For old nurses like myself, what happened way back when is that oncologists, after a cancer diagnosis, would all, in many ways would be considered almost a primary care doctor because cancer really made a difference in your overall care. What we've basically found is oncologists are not very good primary care doctors. So survivorship care planning in many ways also helps us, your healthcare team, understand where we are going to share your care with your primary care physician. So next slide, please. So survivorship care planning should also include the short-term effects that you can expect, either some of those things that started during treatment and we expect to kind of fairly quickly fade, Like some things might be related to nausea and vomiting from treatment. You may have some of that left after treatment, but it should fade fairly quickly. If not, we'd like to know about it. Long-term effects would be those effects that might start during treatment, like fatigue or cognitive effects that may have a more long-term trajectory. So your plan would include when those effects should start to fade, when it's normal for them to go away, and if they don't, when we would like to hear about it. And then late effects would be those effects that you would not expect either during treatment, immediately after, but might be something that you would look for much later in life, like maybe, for example, women like me who took the chemotherapy I had 25 years ago. One of the late effects we're experiencing now is a few changes in our cognitive function about 25 to 30 years after our chemo. So that would be an example of some of the late effects that you might get informed of in your survivorship care plan, keeping in mind that some of those late effects in long-term survivors, like myself, are just simply not known yet. So you and I and the rest of your healthcare team are going to continue to study what survivors like you and I need. So next slide, please. So your survivorship care plan should include a summary of your diagnosis. For you, that would be putting down everything you remember now. For your healthcare providers, it would include everything much more specific, like a specific date of diagnosis, whether it was a biopsy or whether it was a surgical excision, those kinds of things. So provide information about your treatment. So if you're starting the process, fill in all that you can now. Your care plan would be to tell the best person on your medical team to contact with questions or concerns. That may be more than one person, but it should be pretty specific. Provide information about your symptoms or side effects you might experience, who you should call if you need help manage them. And again, that may be more than one person. And explain what type of follow-up care you should receive and who will be providing it. Sounds pretty simple. When you see it on the slide, it can be very complex in today's complex care of cancer. The good news is cancer care is now complex, and it's not a one-stop shop. It just makes it more important, I think, to have a clear-cut survivorship plan. So next slide, please. So developing the care plan, you can ask your healthcare provider to help complete your care plan. You can fill it out with your healthcare provider. You can fill it out on your own and then ask your healthcare provider to review it with you. I think this is going to happen less and less, I think, as time goes forward, which is, I think, good news for us all. You can ask a social worker or a Cancer Support Community Gilda's Club staff member to help you get started. Part of that can be they can help you review the care plan that you've either started for yourself, or you can take your care plan and ask for help if you want to practice some questions that you might have for your healthcare team. So I think it's just a good opportunity for you to find out what's most comfortable for you. Next slide, please. So care plans, templates, and examples. I think Cancer Support Community works very well with our advocates, cancer survivors like you and me, to develop a treatment summary and care plan specifically. For us, what they've done now is a care plan specific for stage 3 melanoma. It's included in the new facts sheet, putting the focus on stage 3 melanoma. A link is available for you here. Next slide, please. For care plans, templates, and examples, I think Journey Forward is absolutely fabulous format for and template for survivorship care planning. You can use a general template, or you can custom make a survivorship care plan for yourself. I use this template in my work as a healthcare provider. They have, in Checking Today, Journey Forward has a mobile app that will help you customize by many disease sites. So if you have breast cancer, it can help you do something, more specifically related to what you may need based on your treatment and expected follow-up care. Or it can be more generic to start. So whatever, again, what you're comfortable with. But for providers, we have care plans specific for breast cancer, colon, lung, lymphoma, and prostate cancer. And we have many of the same matching ones in the mobile apps for us as survivors to reach in and start those care plans for ourselves. So I would just encourage you to look around and see what feels comfortable, what you like for yourself to use. And also ask your healthcare provider team what templates they have and how they best get the information to help you help yourself. Next slide, please. So how can a survivorship plan help you? So once you've completed treatment, you are told many, many things on what you should do. You'll get recommendations on a healthy weight. You'll get recommendations on a healthy diet. You'll get recommendations on exercise. The difficulty is how to get it all done and how to get it all done in a way that helps you be successful. So part of the survivorship care planning process is picking a priority in your care plan. If I need to do all these things to stay well after cancer, help me figure out what is the best and most appropriate priority for me. I think we all know that if you try to exercise, change your diet all at once, it's just certainly asking for failure. So to have someone help you pick what that priority might be, I think is very, very good. Here where I work, we partner very strongly with our Central Indiana Cancer Support Community to help us build a program for survivors that does focus on survivorship care planning and how we can learn both as a group of patients, caregivers, and healthcare providers. So I wish you all the very best. And Claire, back to you.
Thank you. Now, Donna Piant, a melanoma survivor, is going to walk through her experience developing a survivorship care plan for herself. Although her treatment was for melanoma, her care planning experience should be similar to that of a survivor of any cancer. Donna?
Hello, everyone. Donna Piant, speaking, melanoma survivor. Well, to share my patient perspective, being diagnosed with advanced stage of melanoma has certainly been a life changer for me. After my diagnosis of melanoma, I just decided to learn as much as I could about every aspect of my diagnosis, and surgeries, and treatment plans to educate and prepare and be my own advocate. And I decided to share my experience with my fellow survivors to perhaps provide some insight and helpful hints for what I've learned on my cancer journey. Next slide. Let me just say I'm just so thankful for the excellent care that I received from my medical team from Fox Shea Cancer Center. I believe researching and educating and being my own advocate was the best decision I made for my cancer journey. And what I most appreciate was my oncologist knew and respected my self-advocacy, and we worked together as a team for my treatment plan. And I really believe being on the same page with made the transition from my treatment plan to survivorship run a lot smoother, and it just gave me a sense of control over my own disease. Next slide, please. So how I came about this was, when I finished my treatment, although I was so grateful to be completed with my treatment, I remember feeling lost, had a lot of unanswered questions of how to move forward in my survivorship. And I figured it must be the norm to feel this way, so I really never really looked for answers to the questions. So I never received the Survivorship Care Plan. And I was okay with that because, of course, like I had said, my oncologist and I were on the same page, and so I felt like he must have, had a sense that I knew what the next step was. So I say that I was first introduced to the word Survivorship Care Plan through an email from, about a webinar from the Cancer Support Community, and I'm so appreciative of that. And basically, essentially, the Cancer Support Community webinar prompted my search on the Internet, where I came across Live Strong Survivorship Care Plan. And so then I decided to create my own. And so I still continue to do my 3-month follow-up appointments and with my oncologist and, blood work and testing and all. But having this, creating this care plan has really helped me. As you can see on this slide, these, of course, aren't all the facts, for me, but they're fictitious. But you have all your doctor, your oncologist names and your diagnosis, your dermatologist, all the different parts to it that really kind of spell it out. Next slide, please. And for me, I had interferon as my form of treatment, along with surgical, a wide excision. And so when I created this survivorship care plan, I was quite surprised when I, noticed this is what it, printed out for me, that I could experience cardiac problems and that I needed to have a bone density, that they suggested a bone density scan. Really having, these type of details explained really helped me to be a better advocate for myself and to kind of really watch for these side effects, should they arise. Next slide, please. And so you can see on the Survivorship Care Plan that, they have all your updated clinical visits. And, for me, I have it every 3 months. And so, it just pretty much spells it out. And, of course, your primary care provider also, is involved in this as well for all your tests and the like. Next slide, please. And then another surprising fact was, of course, having the bone density, but you're more at risk of having, osteoporosis. And so, of course, I don't smoke, but I understood the importance of exercise, and so I'm swimming to help with that. But I never really considered the bone density, having that done. Next slide, please. And to be able to watch out for cardiac problems was another, like an eye opener for me. And I've been told that going through interferon treatment that you're at high risk of having problems, and by a number of doctors, but I guess it just never kind of like really stuck with me. I should say I'm 4.5 years out now from being diagnosed and I'm happy to report that I'm celebrating 4.5 years of no evidence of disease, which is the best I can hope for a melanoma diagnosis. I really want to say that I am just really thankful for my survivorship care plan, because it's really brought to my attention a lot of things that I've got diseases or not diseases, but conditions that can arise from having, going through the interferon treatment. But then, next slide, please. But also the surgical, aspects of my melanoma excision, the wide excision, where they took out the melanoma had spread to my lymph node, so they took out all the lymph nodes in my left, region, and so there are side effects with that. Next slide, please. And so, based on that, I have to really kind of watch out for signs and symptoms of lymphedema, which I just encountered a few months ago. I started experiencing symptoms of lymphedema, and I did go to a certified lymphedema therapist and had treatment for I think it was a couple months. So, again, having the survivorship care plan has really helped assist me in being a better advocate for myself and to help watch extend my going forward to be able to know that I am in control of my health. Next slide, please. So, what I've learned from doing the survivorship care plan, of course, is the side effects and how they can, what to look for, how I can stay informed for my health, and then how I can share that. I plan on sharing my survivorship care plan with both my primary health care and my oncologist on my next appointments. But most importantly, I feel like I'm in control of my health now. It's just given me peace of mind and helped me to become a better advocate for myself.
We would now like to open the discussion up to the audience. We may have answered some of your questions during the presentation. However, if you have any additional questions, please feel free to type them into the Q&A box to the right of your screen. For our first question, I am going to ask that Kim answer first. How can we work with hospitals to make it possible for them to do survivor care plans that include more than just medical information? Surviving cancer leads to emotional issues that need to be recognized and addressed. Kim?
Sorry, forgot to come off mute. I think part of what's happening, how we can work with hospitals, I think what you're talking about are paying attention to the emotional side of us, in that it's more than just taking care of the symptoms from cancer and what we can do to treat pain and peripheral neuropathy, that cancer affects all of us. And I think from my perspective, for what I've seen in the survivorship care literature and with organizations like the NCCN, which is the National Comprehensive Cancer Network, is for survivorship care, they are asking all of us to drive the survivorship care into the total wellness for us. So ask for those financial concerns that we have left over. Ask for the psychosocial kinds of things that we come away with, how the pain affects our ability to do our jobs, which affects both emotionally and physically and financially, the spiritual kinds of impacts. So I think those of us, who follow the NCCN guidelines are like moving in that direction. So I think how we can, as as advocates and healthcare providers, we can just remind ourselves that we do have more involved in our cancer survivorship care than simply physical. So I think some of that is naturally going to happen. I think the other piece of it as a cancer nurse, as a patient advocate, as a cancer survivor, I walk into my doctor's appointments even now and ask for those kinds of things to be considered. If I'm feeling sad, for my care plans that I help patients with, I usually give a time boundary to some of those emotional kinds of expectations. That if you experience sadness, which we can, cyclically, depending on triggers and so forth, to fears of recurrence and seasonal kinds of things that happen to us, that you have a limit on when sadness is long enough and when you need to call your healthcare provider. So I think some of that is happening, I think, naturally to drive our care, but I think also us walking in as advocates in our own care, like Donna said, on when to call.
Thank you.
Claire, what do you think?
I think that's great. I was going to check in with Rosie and see if she had anything to add to that.
Yeah, I think that was a great answer from Kim. I'll just chime in that I think that during this sort of rollout phase that Kim discussed during her piece of the presentation, now is a really good time to advocate within your healthcare team. And, if you're using a survivorship care plan that's initiated by your healthcare team at the hospital and you see that your psychosocial care is sort of missing from that, this is a great time in this process when hospitals when cancer centers are rolling this out to speak up for yourself and say, I think that a critical piece of my care is missing, and they'll hear you. I mean, your providers are going to care a lot that you want this addressed. You can also always, if you feel like you want to sort of develop a section of your care plan that has to do with your psychosocial needs and fill that out on your own and sort of expand upon what might be in the care plan template that you're provided with, you can always do that with your oncology social worker at the cancer center or with some of the staff at your local Gilda's Club or CSC affiliate. And if you don't have one of those, then the folks on the helpline, which Claire pointed out at the very beginning of the call, may be able to help you go over that as well.
Thank you. So the next question I'm actually going to ask Rosie first. Besides this seminar, are you aware of any other types of after-cancer care resources for survivors? And how would somebody find them and get in touch with them?
Absolutely. There's a whole lot of good quality resources out there for life after cancer, and some of that will depend on your own community. So again, I'll go back to the cancer support community and Gilda's Club affiliates. A lot of the local CSCs and Gilda's Clubs do have support groups or transition programs. It's going to depend on the community and the affiliate what they provide. But for instance, at my affiliate in Ann Arbor, Michigan, we do a Life Beyond Cancer group, which is a monthly drop-in support group for people to kind of help with those questions of how to transition to the new normal and some of the psychosocial concerns that I mentioned before. We also do some combined healthy lifestyle education, survivorship programs that involve support, education, and exercise, both a general survivorship transition program and one for breast cancer survivors. So programs like that are often available for free. They're professionally led, and they're going to be high-quality programs at your local cancer support community or Gilda's Club affiliate. I mentioned before that there are some communities where you may not have a cancer support community or Gilda's Club affiliate may have programs available often at the YMCA or talking with your social worker or staff at your local affiliate, if you have one, may be a good way to identify those, what else is out there in the community. And then for folks who don't have access to a local affiliate or who might prefer to look at survivorship resources on your own outside of the community setting, there are some good resources online. An organization called Cancer Care offers online support groups that are available specifically for post-treatment. The cancer support community also has online discussion boards as well as the helpline that we mentioned, and those are available in this slide set. All of that contact information was discussed earlier on. And there are some really great online and print resources available through the National Cancer Institute, and that's at cancer.gov. The American Cancer Society, I mentioned Cancer Care. So a lot of those, it can be hard to sort through everything that's available online if you are looking for online or print resources. So again, I'll suggest going back to your oncology social worker, your healthcare team, just to make sure that you're finding the resources that are going to be of the best quality. And we at the affiliate level at the cancer support community are always happy to help people find the resources that they need. So even if you're not geographically close enough to go to an affiliate office, there might be someone in your state you can contact who would have a better idea of what's available in your community.
Thanks for that answer. Donna, do you have anything that you want to add to that?
Sure. I have found help, for support through different private groups. For instance, there are many melanoma groups out there, but I know that that's the way that's also true of other cancers as well. So I would encourage people to search through Facebook, but also I would say for you can find many groups, special groups that way. That's how I connected with different people, through different private groups. It's just like you keep connecting with people through your journey, and it's been very helpful for me.
Thank you.
You're welcome.
Kim, this next question is for you. What should the care plan be for a breast cancer survivor? Does it include a nutrition plan or consultation with a dietitian?
Actually, the survivorship care plan for a breast cancer survivor should include all the healthcare team. So the multidisciplinary, I think, care of breast cancer patients in today's world is very well known, but it has drastically improved our care, I think, in the last 30 years. But I think all the team members, I think not or central in that team member, I think in most centers anymore, would be your breast health or your breast cancer nurse navigator. Because if you're old like me, then you might have a nurse navigator in the beginning who's now retired. So, but I think knowing that you have a navigator in your system, you're going to find who you need should you need someone in the future. So be sure and include your nurse navigator as part of your care plan. I think care planning for breast cancer survivors would be very important to know both the generic name and the trade name for chemotherapies or anti-hormonal therapies, because many of us healthcare providers are used to talking in acronyms, or trade names are so much easier to pronounce. Like Adriamycin is much easier to pronounce than doxorubicin. But when you're looking for symptoms and side effects and things to worry about in the future, you may run into one name or the other. So I think those would be critical pieces to include in the care plan. For me, for all breast cancer survivors, bone health is a critical piece, like Donna was talking about. The DEXA scans are a big piece of that Bone health, many of our anti-hormonal agents, the aromatase inhibitors, can actually weaken bones. So bone health, when it needs to start, when it needs to be done, if a baseline was done at the beginning of treatment, when is your next one due? I know here we have, fabulous oncologists, but memories can fade. Things can happen from being the time you see your doctor and check out with the receptionist. So maybe some check mark or some test to be scheduled at your 6-month follow-up may or may not make it to your report. Not by anybody's fault. There are many, many steps usually in that process. So for us, some of the glitches for us come from central scheduling and that we're required to use. So I don't want anyone to not have a critical piece in their survivorship care plan because part of that care plan is what you're responsible for then. And if you need to have a DEXA scan in 2 years, it's just great. From my perspective, if you call me up and say, Kim, I'm due in 6 months and I haven't heard anything about my DEXA scan, can you help me with that? And so knowing those pieces are important. I put the emotional well-being kinds of pieces right in my care plan. I want you to know all those kinds of things that are important for me. They're very important for breast cancer survivors. I think fear of recurrence is a big issue for all of us. It's in the top 5 concerns for long-term cancer survivors for a lifetime. Because breast cancer survivors can survive for a long time, we want that fear of recurrence to be at a minimum. So things you can do about fear of recurrence are a must-have in that care plan. The second piece of the question, does the care plan include a nutrition plan or consultation with a dietitian? It certainly can. I have specific dietary and nutrition recommendations that I go through with patients, and but we also have a fabulous clinic where a one-time consultation at no additional cost can be had with one of our oncology dietitians. So for us, a consultation with a dietitian can be had very easily. For those of you out there where it's desirable to have that happen, you can make that happen. I think oncology dietitians have a different perspective a little bit on nutrition, but many of their recommendations are going to be from, good, healthy eating, like the dietitian that we have with our cancer wellness program, our cancer, after cancer treatment plan is a dietitian who just absolutely loves public speaking and healthy lifestyle, healthy eating. She actually takes us on a tour of a grocery store to remind us what is best and what is the goal in eating each and every different food group. So for myself, that was even more helpful than an individual consultation with a dietitian, but we can certainly make those consultations happen should they need to happen. But a lot of that, whether a dietitian visit happens or not, is driven by you as a survivor and what you may need. A lot of patients tell me they know what is best to eat. They're just having trouble getting it done. So that's in a different category. That's more of a healthy lifestyle coach. Claire?
Thanks, Kim. The next question I'm going to address to Donna and ask her to answer first. How do you stay positive and plan for your survivorship in the middle of follow-up tests? I think another way to ask this question is, do you get scan anxiety, and what do you do about it?
Oh, yes, absolutely. I feel like in between scans, I feel like it's almost like I try to compartmentalize my diagnosis and say, okay, that's over here, and as the time gets closer, I get a little, snappier, and I find myself snapping at my husband and my friends, and then I realize, I question what's going on, and then I realize, oh, my scan's coming up, or a biopsy. I'm waiting for a biopsy, for an abnormal mole. So for me, I use distraction, and I find it best to distract myself with, trying to encourage my other survivors that I've become friends with online, and I exercise. I jump in that pool when I'm at the most stress. I try to do that all the time, but I find myself swimming more, and I laugh. I try to just really focus on, okay, I am alive. Yes, there's a lot of side effects, and yes, there's a lot of things that I'm continually overcoming from my cancer treatment. But I am alive, and I count my blessings, and just really try to focus on that. But it's hard. It's really hard sometimes to. But I'm very blessed to have a very good sister, sweet sister that just is. I can pick up the phone at any time and say, I'm really having a hard time with this. This is what's going on, and she always makes me laugh and always encourages me. So, but everyone does what they feel helps them. But that's what helps me. Thanks,
Donna. Rosie,
Hi, Claire.
do you have? Yeah.
This is Kim. Could I add something to that? Donna, I think everything you said is absolutely great. I mean, the distraction when you need it, the social networking when, you've got to pull in your village. I think the other piece is know that you're doing all that you can do to reduce your risk of recurrence, that when you get really worried and you need to focus on the positive, you just pull yourself together and say, I'm doing all that I can do to reduce my risk of recurrence. I'm doing all that I can do. And that, even that simple statement can help you pull that positive kind of thinking back to where it needs to be.
Great. Rosie, did you have anything you wanted to add to that?
Yeah, I think that both Donna and Kim did a great job talking about some of what you can do to help manage that anxiety. I'll just add, there may be moments where you notice more of a change in your level of anxiety than you've experienced before. If you're experiencing really significant anxiety that lasts for a long time, it may be really, really smart to talk with an individual counselor. There may be resources available for counseling at your cancer center or local CSC or Gilded Club affiliate, or you may want to work with someone in a private practice. And to really keep a close eye on your own emotional health. And if you notice a big change, it is important to reach out for help when you need it. So just know that there are resources available on top of those great coping strategies that Donna and Kim mentioned.
Thanks. The next question, I'm going to start with Rosie. Do you have any special guidance or advice for cancer survivors who are aging or older? The person who wrote the question wrote 65 years and older, but anyone who is feeling a little more frail or family members of an older cancer survivor in terms of survivorship planning.
Sure. Do you mean in terms of healthy lifestyle activities, for instance?
Let's start with that.
Okay, great. Kim may be able to address more about sort of the survivorship care planning process on the medical side, but in terms of transitioning to survivorship as an older adult, a lot of the activities and programs that I mentioned really are geared towards people of all ages, but a good number of the cancer survivors living in this country are 65 and older, and there's no reason that your age should limit you from being able to be physically active in ways that are healthy and safe for you. So the first thing I would say is always talk with your healthcare team. Even at my affiliate at the Cancer Support Community, we make sure that anyone, any age, any diagnosis, and even the caregivers who come in who's participating in a program, an exercise program, has checked in with their healthcare team to make sure that it's safe. So it's a good idea to just sort of strategize with your healthcare providers before you get into doing any kind of an exercise routine after cancer treatment is complete. But then just, like I said before, taking it slowly, finding the things that work for you that don't feel like you're pushing your limits, especially right away, and talking with the folks who are providing those programs. A really great thing about the classes available at cancer support communities and a lot of times through YMCAs and other community organizations is that they're led by people who are trained specifically to work with folks who've dealt with cancer and cancer treatment. And they're used to adapting those classes to meet people's individual needs. So I can speak for the cancer support community and Gilda's Club's affiliates and say that if you want to get into an exercise class like yoga or Tai Chi, but you're worried about your own physical ability and sort of what your comfort level is in terms of how much you're exerting yourself, then it's absolutely okay and really sort of recommended to talk with the instructor ahead of time and express those concerns, say what you might want to work on, and work together with those instructors to get the kind of exercise workout that's right for you. And I think I should probably turn it to Kim to talk about the care planning process for older adults.
I think first I want to mention Rosie's said a couple things I think that are incredibly important to me when I think in terms of where I send patients for care. I send patients to care to places where I know, like Cancer Support Community, the programs are professionally led, so that they're quality programs and the information being provided is not going to go into myth or miscommunication. So as a healthcare provider, that's extremely important to me when I make a referral for help for our patients. So when I think in terms of exercise programs, I want to know that they're professionally led, that the professionals taking part in those programs are already vetted for me. I've just had so many instances where people have come back and they've been part of programs that have not taken good care of them. And I would just encourage you all in your self-advocacy and advocacy for family and friends just to make sure that do your very best to find programs for them that are good quality and professionally led. I think special guidance and advice for aging elderly patients, people over 65, cancer survivors over 65. I think there are two big things that I think are important in survivorship care planning, and part of this is in a professional kind of assessment way. As we age, we're at higher risk for falling. So part of the assessment and care planning process for patients in the older category for me would be included in risk for falls, and if someone is at risk for falls, what we can do specifically for that person. And so that's more of an individual assessment, but in many ways for us that's a plan to rebuild an exercise program focusing on the core strength, because that's where you balance and you can reduce your risk of falls when you have a better and stronger core. So I have a tendency to refer a lot of the older patients I see for strength and resistance in the core for better care. So that's part of both the assessment and the care planning. That's certainly something if you're building your own care plan, your own intervention, you can hire a personal trainer. There is a cancer certification in personal training. Our healthy lifestyle coach has that because she does our resistance and exercise training portion in our program. And so there are people out there specifically who can work with you on an individual basis. For older folks, I think the other piece for older patients that I like to focus on in Survivorship Care Plan is cognitive function. There are many things about a cancer diagnosis and cancer treatment that can, in the short term, affect cognitive function. And so part of our task in survivorship care planning is trying to understand what might be related to the cancer diagnosis, cancer treatment, and what might be something else. So part of my care planning is to help patients understand when their time limit on cognitive function effects from their cancer therapy might be. And I think in what we know in today's world, it's more cancer diagnosis and cancer therapy combined that affects cognitive function. So those are the two things that really popped clearly into my mind. But I'm like Rosie in many ways in that people of any age with cancer and with many of our cancer treatments can become quite debilitated quite quickly. And so your body can feel 60 or 65 when you're really chronologically 35. So there are many interventions that like programs for younger people where their exercise programs just simply would not fit. People have to start just much, much slower with their physical recovery. Claire?
Thank you. So I have a very specific question here that I'm going to make a little more general. They talk about having a second cancer diagnosis 10 years after the first. With survivorship care planning, would your care plan tell you who to consult about treatment of that second diagnosis? Do you both talk, if for instance your first diagnosis was lymphoma and your second diagnosis was a breast cancer, would you go back and consult with that same medical oncologist when you received your second diagnosis to see what made most sense? Kim?
I would say it depends on the treatment center. I would certainly check in with my original oncology team, particularly my medical oncology team. Say if you're to see, like I've worked in a large medical center where they had specialists by disease site almost. So you would have a breast cancer specialist team. So your breast cancer would be treated by one team and your lymphoma perhaps by another. Where I work currently, it would be our oncologists are, it's a more general practice, so you would definitely see the same oncologist initially, and then I wouldn't be surprised at all if that medical oncologist would say, I have a colleague who does this a little better than I do. Would you like a second opinion with them? So I would have a tendency to start back with the original team. First of all, I want them to know that I have a second cancer. And second of all, I have a bond and a trust with that team, if that's the case for you, a bond and a trust, and help me out here. Who do you know? Who are your colleagues who might be best for this? Or if you are top-notch in this, doctor, please tell me so, and we'll get started. Is that close enough, Claire? Or?
I think that's a good answer. And Rosie, if you have anything to add, you're welcome to jump in now.
I think Kim covered it.
Great. Then the next question that I have is, what can cancer survivors do to ensure that their primary care provider are providing appropriate follow-up? If you're a cancer survivor and you end up with back pain or headaches or pain in your breast, and you're worried that your primary care provider might dismiss something that is causing you a lot of anxiety, what can you do? Kim, I think I'll ask to start with you again.
I think several things really come to mind with this. There are an organization I mentioned earlier, the NCCN, the National Comprehensive Cancer Network, has a series of guidelines for cancer care. Like they'll have a guideline for breast cancer and follow-up and routine screening and those kinds of things. Those are available online. I mean, you may have to register to get some of that information. That's one thing you specifically can do. There are also guidelines published in, like the American Cancer Society online has specific guidelines and encouragement as to when to call healthcare providers, as does ASCO, the American Society of Clinical Oncologists, which is one of the leading groups for our oncology teams. The Oncology Nursing Society, which is kind of the lead society for oncology nurses, have guidelines and help for patients knowing when to call, when to kind of push their healthcare team. I think if this is more a question that might be more in say maybe a health maintenance organization where a lot of your care payment is linked to a referral from your primary care doctor, I would say some of that would be most of us, like once we've been referred to an oncologist, even an HMO, it's almost a carte blanche. If you need your oncology team again, then you call on that oncology team. If you don't think you're getting enough from your primary care team, I would say go to your oncology team. If you're having questions about whether your oncology or whether your primary care team is doing enough, then that's enough information for me. That's when I would have you call. You're having questions, you're having concerns, you don't understand, that's when you call your oncology team. So it just sounds like it's one of those where you want to make sure your primary care doctor is doing all that they can do, or maybe you feel like they're minimizing symptoms or concerns. Then it's time to call on the oncology team, your nurse navigator again, or a more professional advocate within your healthcare system. Your nurse navigator then can call back to your primary care provider on your behalf and say, what's up, what's going on, what are you thinking, so that they can have a conversation on your behalf.
And Rosie, do you have anything that you want to add to the answer to that question?
Sure. I think that was a great point by Kim about, calling your oncology providers if you have any kind of concern about the care that you're getting at your PCP. I'll also just sort of validate how hard it can be to get all your questions answered in any kind of medical appointment. So if you're going into an appointment with your primary care provider, it can be really helpful to develop some of those questions that you want to make sure to get answered ahead of time. If you have a new symptom that's significant, or your survivorship care plan can be a really great starting point for that. But to just kind of go in with an idea of what you want to make sure you accomplish. And if you feel like you're not being listened to, absolutely, like Kim said, to contact your oncology team as well. But I think, sometimes you may not be getting the information that you feel like you need because you may not know how to ask those questions, and that's really normal. But working with some trusted allies, your family members, your social workers, any experts that you have that that you work with regularly to help you develop what you want to accomplish when you go in for your primary care appointment can help you feel a little bit more heard and like your concerns are being addressed.
Thank you. There's a question here that is about survivorship planning that includes planning for end-of-life, palliative care, and hospice. One of our participants said that their mother's doctor suggested hospice over a year before she passed away, and is that something that should be considered in a survivorship care plan? Kim, can I get you to start?
Yes. I think, so what's the best time to call in hospice? Hospice generally, a general rule of thumb is that hospice is basically there for us when our healthcare providers think we're within the last 6 months of life. And, if that recommendation would come from me or one of my family, I would transition to hospice probably as soon as that recommendation were made. Not because I think death is so imminent, but that I think hospice is just so phenomenally good. Hospice is a very holistic care for us, family-centered, patient-centered, and it really takes the all of us into perspective. Getting into hospice, I think, earlier rather than later for me would mean that not only am I well cared for, my family is well cared for and ready for my transition, as in dying. And that's incredibly important to me, that my family understands what might be happening with me, and to get all of us to hospice, I think would be incredibly fabulous. There's nothing wrong in my mind in living beyond hospice. Like if for some reason I would be living beyond my 6 months, I mean, hallelujah. I've still taken the fabulous advantage of getting myself and my family organized into a really good place in our care. And if things have to go longer than 6 months in a good way, then so be it. So I think hospice should always be considered for us all. If it's a part of my general discussion in survivorship care planning, that I touch on advanced directives in that I want people to have a healthcare power of attorney. I want them to have a living will. Cancer is just a huge motivator, and to put these things in motion so that we protect ourselves and we protect our families. We help our families understand what we want, when something should happen. It just helps ease that whole situation, that family knowing situation. I'm a nurse. I'm a cancer nurse, so having some of these conversations is easier for me. It's hard for some of my family members, but some of them have just been pressed a little bit to have these conversations with me. It's okay for us as cancer survivors then to push our families a little bit because we've had this great motivator. I've just had the wits scared out of me having experienced cancer, so let's just talk about this a little bit. These are the things I want done. Hospice can help us do that. The concern about hospice, advanced directives, making those advanced plans, I think honestly should always be considered, and I think are frankly very good for the most of us. So I think that's my first response. Claire, do you want to take it back to?
Sure. Rosie, did you have anything you wanted to add to that answer?
I actually think Kim did just a great job of answering that. I'll echo that it can be really hard to have those conversations, but it's so important to do so when it's time, and hopefully your healthcare team will really guide you there.
Great. Well, we are coming near the end of our time, and the remaining questions really have to do with how do I find the resources I need either around advanced directives or financial issues, or if I have particular special needs issues and support issues. And so I guess I'm going to start with Rosie and ask certainly in locations where there is a Gilded Club or a cancer support community, there's somebody to ask pretty close by, but where would you turn to ask some of these questions of where to turn to get answers on some of these issues that come up when you're doing survivorship care planning?
Sure. So if you don't have access to a cancer support community or Gilded Club affiliate, I would say if there are oncology social workers available at your cancer center, they would be a really great place to start. Also, we've heard references to nurse navigators a number of times. They may be really helpful in doing this. Something that I know from working in the medical community is that a lot of the time coming in, this has been mentioned already, but coming into your doctor's office, with a blank care plan is not the way to go. You want to start that process with somebody. But it's a matter of probably identifying your sort of allies on your healthcare team, your social workers, your nurses, the people that you have more ongoing communication with, and they should be able to help you get the process rolling. I'd also say call if you really feel like there's nobody in your cancer center who can help you with this, calling the Cancer Support Community Helpline may be a good way to go. And looking outside if you're quite far from a cancer support community or Gilded Club affiliate, but there might be one within your state. I know if I got a phone call from someone about this, in Ann Arbor, and they were somewhere that they couldn't reach an affiliate closer by, I would certainly help at least point them in the right direction and do a little bit of research for them about the resources that are available.
Great. Kim, do you have anything to add?
I think for resources for advanced directives, specifically here for our hospital, our chaplains in our spiritual care department are very helpful. in helping people walk through advanced directives and that individual support on how to actually get one in motion. We also have advanced directives kind of forms available, so with kind of like step-by-step directions on how to think about the process. It's certainly not an easy one, and I would say I absolutely would second the motion on what Rosie was saying too. It's to walk in with a blank care plan and just lay it on the counter is not the best way to start the process. So have something in mind. I think we've same thing with advanced directives. Have just a little bit of direction or something in mind will help the professionals help you the best. So.
Thanks, Kim.
Sure.
At this point, I'm going to ask Donna first and then Kim and Rosie if you have any last-minute things that you want to make sure that before we leave, folks listening here.
Well, I will say that I believe that Kim and Rosie both pretty much emphasized on is making sure that you have that you make it. I created my own Survivor, but I plan on, of course, reaching out to Cancer Support Community and having them really build my Survivorship Care Plan, because I feel like it'll be I'm sure there's a lot of things that I may have not I've missed in putting in the details for when you're creating this. So the outline. So I will say that, and then the also thing is the emotional part. It is so critical to overcome and to realize that because you've survived, things can really come up later on, and you get it's called survivor's guilt. When I find I get that when I suffer from that when I find someone that has passed away that was diagnosed maybe at the same time as I, or I've become friends with them, and so it's you start questioning, well, why am I allowed to be here? So that's very real survivor's guilt, and so for me, I experienced other side effects, so that I reached out to my different people on the medical team at my cancer treatment center, and they were able to assist me to find the right, care that I needed to help with the issues of wanting to eat again after my treatment, which is kind of like an ongoing. It's just a side effect that I've experienced from my cancer treatment, even all these years later.
Well, thank you for bringing up those important issues and making sure that people look into getting resources to help themselves. Rosie, do you have any last words you want to make sure?
Sure, I'll just say briefly that I think that, seeking information like this out, initiating a survivorship care plan, developing questions to ask your doctor, all of these things are, they're active and they're empowering. And taking these steps to go through this process, I think, can be in itself quite a comfort throughout the survivorship process. So I'll just commend the folks who are looking into doing this. And I know that sometimes asking these questions can be extra work. It can be hard to take care of yourself, especially when it comes to the emotional health. But it's a process worth doing. And I think that we've heard so much today about how valuable it can be, both to protect yourself physically and emotionally through survivorship. And I appreciate the opportunity to talk with you all today.
Thank you. And Kim, we've got about 30 seconds left if you have any last thoughts you want to add.
I wanted to sincerely thank Donna for stepping up to plate and sharing just so clearly her story. It's not easy, and I just wanted to applaud that. And survivorship guilt is real, and I think it's another reason you need to call on your healthcare team and be brave enough if you need one-on-one counseling. There are ways to get that done. I, for one, can say it's well worth it. So I think that's it, Claire. Thank you very much.
Well, everyone here at CSC would like to thank all of our wonderful panelists, Rosie Morrison, Kim Zeiner, and Donna Piant, for contributing their time and sharing this important information with us. Thanks to all the participants who listened in and added questions and have helped make today's webinar a success. If you would like more information, please visit the CSC website or call our toll-free helpline. We did set up a web page with all of the resources mentioned in this webinar. That's www.cancersupportcommunity.org/survivorshipwebinar. And we also want to let you know that our upcoming September 29th webinar, Frankly Speaking About Cancer, Clinical Trials and the Cancer Moonshot, is coming next month. For information about this or any other webinar, visit www.cancersupportcommunity.org/webinars. And Cancer Support Community would also like to thank our program supporter, Bristol Myers Squibb. Please take a moment to complete our webinar evaluation survey, which you will be automatically redirected to. We greatly appreciate any feedback you may have.